All right, we are live on LinkedIn and YouTube and Instagram, so we can go ahead and jump in. Happy Wednesday, y'all. I'm so glad to be talking with you today. As usual, if you've been following me for a while, you know that we do these medical and health writing tips conversations every week from about 7:30 to 8. And over the course of the next 3 weeks, there's going to be a little bit of a theme to these live stream videos. So we are going to be going back to the basics of medical and health writing. The reason being is because there are so many different types of medical and health writing. And I realize in conversations with people sometimes that when I ask about the types of health writing that you might be interested in, sometimes maybe you don't know how to answer that question because you didn't realize there were different types of medical or health writing. And if you did know that there were different types or kind of subsets or subspecialties within them, you don't necessarily know what they are or the full range of them. So starting today and over the course of the next 2 weeks following this, we're going to be talking about the basics of some of the more common types of medical and health writing. And today in particular, we're going to be focusing on regulatory writing, medical information, and medical communications. I am Megan Freeland. If we haven't met yet, it's great to meet you. I'm glad that you are here with me today. I'm a public health pharmacist by training, but I work as a health content strategist and health communication specialist. I run a health content marketing agency called Stock Rose Creative and also a program called Health Professionals to Health Writers. And my specialty is really in health content marketing, which is a very specific type of health writing. But if you have watched videos where I've talked about my background or how I got to where I am today, or you've looked at my LinkedIn profile, you can see that I've had a lot of different experiences within the realm of medical and health writing. So even though I've chosen my little home to be in health content marketing, I also have awareness of a lot of different other areas within this space. And so I want to share that knowledge with you all over the next couple of weeks. So what we can do is go ahead and jump right into things. Before we do that, I will offer a disclaimer that even though I do have experience with a lot of these different types of medical and health writing outside of health content marketing, they are not my current specialty. I've been kind of in the health communications and health content marketing space since about 2017, 2018. And so when you come to me with questions about like regulatory writing or medical information, I'm going to give you what I can, and then I'm going to refer you to somebody else who is more of an expert in that space and who's currently, there and can better answer some questions for you. But I'm excited to be able to provide some background. Hi, everyone who's listening in. Hey, Neka. All right, so let's get started with regulatory writing. And of course, if you have questions, drop them in the chat as you're watching, whether you're catching it live or on the replay. Let's begin with regulatory writing. So what is regulatory writing? Basically, this is where the writer, is creating documents or reviewing documents or editing documents that some type of regulatory body or regulatory agency requires. So of course, when we think of regulatory bodies or agencies, we can think of agencies like in the US, the Food and Drug Administration, the FDA. Perhaps in Europe, it might be the EMA or whatever your regulatory agency is in your specific company. But as a regulatory writer, you are really preparing documents for that specific audience, for that regulatory audience. And usually the documents that you are creating or editing or revising in that type of role are related somehow to a phase of drug research or development. So, for example, you might be creating documents like investigational new drug applications or new drug applications, or maybe you are updating an emergency use authorization. We've been hearing a lot about those over the past year plus due to COVID and the vaccines that are authorized under EUAs. Investigational brochures, whatever the document is that you're creating as a regulatory writer is really going to depend on what phase the drug or the vaccine or the device what phase of research and development that product is in, because that's going to dictate what kind of documentation needs to be on file with that regulatory body in order for everything to be A-okay. So where you would find regulatory writing opportunities most often would be within the pharmaceutical industry. So whether that's a pharma company, biopharma, biotech, this is a highly regulated industry, as we all know, as health professionals. And so there are a lot of documents that have to be completed in a very specific way and have very convincing bodies of evidence and research that support, right, whatever position the pharmaceutical company or biotech company wants to have. That kind of supports whatever outcome they're looking for that regulatory body. So there's really a lot of research and a lot of understanding regulations around the industry that's required to be an effective regulatory writer. Also, medical device companies, regulatory writers are important there, and clinical research organizations. As far as folks who are interested in getting started in regulatory affairs, actually, before I talk about that, I will mention that sometimes you might find an organization or an entity that is not one of the ones I listed that does have kind of a small regulatory arm. My regulatory experience was at the CDC, and as you might know, the CDC doesn't develop new drugs or develop drugs at all. And so the work that we did as a regulatory team there was much different from what you might see at a pharmaceutical company. But usually it's going to be a company in that pharma space that is in need of more regulatory writers. And so as far as getting started in regulatory affairs, one of my biggest suggestions is to look into the Regulatory Affairs Professionals Society, or RAPS for short. If you go to their website, you'll see that they have a lot of information and resources, not just for people who already work in regulatory affairs, but also for people who kind of aspire to get into that space. And so you'll find programs there, conferences, courses, and other resources that will help you learn more about regulatory affairs. I mentioned previously that a lot of the documentation that is a part of the roles and responsibilities of a regulatory writer is dependent on where a drug, vaccine, or device is in the research and development process, which means that you have to be pretty well versed and aware of what that research and development process is. So when it comes to learning information and things that would be important in that regulatory space, you want to be working on increasing your knowledge of what that process looks like, and RAPS would be a good place to kind of get that background information, and also to network with people who are already in the regulatory space. So speaking of networking, and this is going to be a part of my recommendations for every single type of medical and health writing we're talking about, make sure that you are seeking out people in regulatory affairs who are either in your personal networks or who are in your networks on LinkedIn. You can search for regulatory writers, you can search for regulatory strategists, and you can learn from what they are naturally sharing on their own, or you can reach out and try to spark a conversation. But making those actual connections and building that network in the space that you might be interested in moving into is going to be very useful for you. Also, another recommendation you're going to hear me make consistently is to find job descriptions for these positions that you're looking for. Look at the documentation or the types of documents that they talk about in that job description, and then go try to learn more about what that type of document is. That's another way to help build your awareness and education around some of these regulatory documents that are involved in these roles. So that's regulatory writing. And I didn't even put up my little banner right there. We just completed regulatory writing, and we are going to move on to medical information. So medical information is, I wouldn't call it an umbrella term at all, but the specific role can vary based on a lot of different factors. The common denominator between medical information roles is that you are using your writing skills to prepare documents that answer medical questions. And those questions could be from fellow healthcare providers, but those questions could also be from the general public. And depending on the specific medical information role, maybe you stick to providing med info for other HCPs, maybe you provide med info for consumers, maybe you do a mix of both. In my experience in medical information, my role involved a mix of both, but it was more heavily weighted on providing responses to healthcare providers within the health system that I had that medical information role in. And so basically what you're doing a lot of times is you are either proactively or reactively crafting written responses to important medical questions around a particular medication, especially if you are if this role is baked into a pharmaceutical company. Oftentimes they'll have different departments depending on the therapeutic area and what drugs or vaccines or devices they have in that therapeutic area. And so there'll be a med info team who has a specialty of like cardiovascular drugs, or their specialty are the birth control drugs. And so a lot of times the questions that they might get are about that specific therapeutic area and the drugs that fall within that therapeutic area, and they're able to respond to them reactively. But there's also some strategy involved because you might be anticipating, hey, what are common questions that we think we're going to be getting about this medication? And how do we go ahead and proactively craft a body of written communications materials that can answer those questions? So you'll see medical information opportunities in the pharmaceutical industry. So pharma, biopharma, biotech, and also you'll find them in hospitals and health systems, as well as at the FDA. This role, if you are a health professional and you've ever had to find the phone number of the manufacturer and call to ask a question, you were probably communicating with someone in their call center who has some training in medical information. And then if they had to then say, hey, we'll get back to you on that, then what they probably did is they went to their in-house medical information team and said, hey, we don't have a pre-crafted response to this question. Can you all answer this question, basically? And then that in-house medical information team probably crafted that answer to the question, and then they forwarded it to you. But the medical information infrastructure is what you are communicating within when you call up a manufacturer and say, hey, I have a question about this. So the pharmaceutical industry med info is critically important. Again, a lot of hospitals and health systems will have a drug information or medical information unit. Sometimes they use the term interchangeably, but the concept is the same. And so they might field questions from healthcare providers within the health system or consumers who receive care within that health system, but the rules of the game are pretty similar. And then at the FDA, there's also a drug information division where a lot of answers to these medical questions are being prepared as well, in addition to resources and materials that help explain drug information and medical concepts to consumers. As far as getting started in medical information, the American Medical Writers Association would be a good resource pretty much for any type of like medical writing where there is a healthcare professional audience. I think that AMWA, or the American Medical Writers Association, is a good resource for that. Again, also connecting with folks on LinkedIn who are medical information specialists and can provide some more insight. Sometimes even just looking through their profiles and seeing like what their trajectories were to get to that position within medical information is helpful, because it kind of informs you what path they took and how you might in some way apply that to your own situation. And then also, I also recommend finding opportunities locally within your own environment to practice the skills that would be useful in a medical information role. So when I create these videos and through my program, right, I'm mostly connecting with health professionals who are interested in medical and health writing. So if you are a health professional, you likely work in some type of care environment, whether it's a hospital or a walk-in clinic or pharmacy or what have you. And so there are probably opportunities within that environment for you to actually practice providing written answers to different drug information or medical information questions that might be important for your colleagues to know. So if you could volunteer to serve like as a resource for your team, or if your establishment already has a drug information or medical information department, maybe offering to take some work off of their hands and craft a sample response. Really just any way you can kind of get your hands dirty within that setting and start practicing. Starting a newsletter, there are a wealth of creative ways that you can think of and engage with so that you can get the practice you need. Because the thing is, if you don't have experience in medical writing, you have to find it or you have to create it. But you don't really get medical information, or you don't really get medical or health writing roles if you don't have that experience. So again, you either have to get that experience or you have to create it for yourself. And looking within your individual circle, network, environment is going to be a great way to find those opportunities that you can take advantage of, or to create those opportunities for yourself. And then lastly, we'll touch on medical communications, which is another form of medical writing. Typically, the audience for the materials that you create as a medical communication specialist, typically that audience is going to be a health professional audience, although there are some cases where you might create materials for the general public. But in most cases, you're going to be creating materials for other health professionals or for other people who are going to be interacting with health professionals. So we'll get to that in a second. I know that might have sounded confusing, but basically what you do as a medical communications person is you create a variety of materials that health professionals use, health professionals and stakeholders use to communicate scientific and medical information with each other. So, for example, this could be a manuscript or a peer-reviewed journal article. These could be poster presentations at conferences. These could be the training materials that a sales team at a pharma company uses, that a pharma company uses to train their sales teams, so that when that sales team then goes to a doctor's office or goes to a hospital to speak to a health professional, they are well versed on the medication. So that was that comment, right, about maybe you're training someone who is an intermediary to another health professional. But basically, you're creating materials on behalf of a pharmaceutical company that helps them communicate the critical information about a particular product. So the purpose of the materials that you're creating, that purpose might be educational. That purpose could also be promotional. So there's kind of, depending on the specific role or the specific opportunity, you might be creating educational materials or promotional materials or a mix of both. But essentially, medical communications agencies, which is where you find a lot of these positions, they kind of exist, they kind of provide consultative services to a pharma company, a biotech company, a biopharma company, in order to help them get the materials that they need in order to spread information about their products. So in terms of where these opportunities are, sometimes they are in-house at actual pharma companies, but a lot of times, again, they are at specific medical communications agencies who then work with these pharma companies. As far as getting started, I would recommend going to your favorite job search platform, typing in medical communications, look at those roles and those job descriptions, and look at the specific responsibilities or duties that are expected in them, and then find ways to practice doing those things. So for example, based on the sample materials that I mentioned to you just now, right? You know that you might need to develop a slide kit or a slideshow as a part of this package that you're creating for a pharma company. So if there are opportunities for you to create and develop presentations and even to deliver them, that is an example of a skill that would be helpful for you to hone and that you don't have to be in a medical communication space to do, right? Like I'm sure you could think of some type of presentation that would be helpful for you to develop and deliver in your particular workspace. So that's an example of what I mean by going and seeing what those responsibilities are and then figuring out how you can find or create those opportunities on your own. Again, connect with organizations that can help you do that, like the American Medical Writers Association, and connect with individual people who can help you learn that. So if you go to LinkedIn, use that search bar to search for people who are in medical communications positions, connect with them, ask them questions, reach out. And that's another way to, I forgot to change this banner yet again. That's another way to learn more about medical communications roles. So I think those were the 3 specific types of medical writing that I wanted to cover today. If you have questions, comments, feel free to leave them or to message me. Again, if these questions or comments are very detailed or specific to these types of medical writing, I highly encourage you to look up other medical writers on LinkedIn who are more thoroughly entrenched in these spaces. Again, my specialty is health content marketing, which is a specific type of health writing. It's not a type of medical writing. And so what I'm going to be able to tell you is much more superficial than what someone else who currently works in this space and has a real background in this area is going to be able to tell you. But thanks for tuning in today. Next week, I will be back with 2 more types of medical writing. I believe we'll be talking about medical education or CE writing and grant writing. Hold me to that like by 85%. I'm pretty sure those are the topics I scheduled out. Those will be next week. And then the following week, we'll dive into 4 types of health writing that I'm really excited to talk to you about. So have a great one, and I'll see you next week.